Welcome to the GTA Advisors Podcast. We interview Greater Toronto Area business owners, entrepreneurs, and thought leaders. Our goal is to bring Greater Toronto Area residents the best advice from our community's brightest minds. Now, here's your host, author, entrepreneur, and real estate innovator, Robert Caruso.
Welcome, everyone, to another episode of the GTA Advisors Podcast. I'm Robert Caruso. I'm here with Dr. Rogini from York Family Chiropractic Care. They are located in Maple, basically Major Mac and the Keele area, right across the street from the new public library in the HHC Center. Dr. Rogini, are you there?
I am there. Hi, Robert.
Oh, great. I'm glad to have you onto the show. Before we talk about your chiropractic care profession, maybe you can just give us a little bit of your backstory. Where did you grow up? What do you enjoy doing in your spare time? And what did you do before you started your chiropractic practice?
So before, I grew up in Toronto, and I kind of was all over the place because, I went to Hamilton, did my graduate at McMaster University, and did my chiropractic in the States. And in terms of what I've done in my spare time now, I love to spend my time with my children. And also I do a lot of research. I'm always learning, trying to self-develop, reading books on self-development. And also, you always want to be better in something, what you do, right? So I spend my time learning more in chiropractic, be a better chiropractor, and be a better mom, a wife, and it can keep going on. So I don't stop learning. And then also, as I said, spend a lot of time with my kids and, keep, with their activities and all that stuff.
Yeah, that's fantastic. Now, obviously, we know you went to school to become a chiropractor. You explained that already. But what made you choose to become a chiropractor?
Oh, that's a long story, but I'll make it short. I actually wanted to be a medical doctor, to be honest with you. And but then I faced challenges. So, something didn't click fully that I really wanted to be a medical doctor. And in my second year of university, there was, you know how they come from different schools and they set up booths and kind of show up those kind of like a vendor's table kind of thing. So I was there and I saw information about chiropractic. And what really made me excited, the fact that it's a healthcare profession that can help people to heal naturally. And that word natural just amazed me. I was like, oh, this is interesting. And then I started researching. And the funny thing is, I didn't even know what chiropractic was at that time. I'd never seen a chiropractor. I have no idea what a chiropractor is. And at the same time, never even noticed chiropractic clinics. It's like, how you talk about a car until you mention that name, you see it around.
There's a name for that. It's called reticular activator.
It's embarrassing, but really, I didn't know what a chiropractor was. So, and what happened is I started doing the research, and I was really amazed how the body had that power to heal. And what I did, I actually shadowed a chiropractor, and to see the patients when they were coming out so happy and they were so like complimenting the chiropractor, and I never seen that before. Like, you come out of from your regular doctor and you just like, you don't see that. Do you understand? It's a different type of atmosphere. And then I started getting adjusted for myself because I had my own issues. I had neck issues that I would get a spasm in my neck, like maybe 3-4 times in a month where I cannot turn my neck. And that just got better and better over time. And I was amazed about that.
Okay. Now, we did chat a little bit before we started the interview, and I really need you to clarify this. Now, I was under the assumption that a chiropractor is a chiropractor, but you told me different. Please explain to the listeners because they all need to hear this. For
sure. There's two different types of practices. There is vitalistic practice as a chiropractor, and then there's also the mechanical, like symptomatic practice. So in terms of symptomatic care is more, let's say you have neck pain, and they focus mainly on your neck issue, where the pain is. And the vitalistic practice is more helping the body, kind of tuning the body and helping the body to realign so it can function optimally in a highest level. So that's the real purpose of chiropractic. But over the years, it has changed over the time. And keep in mind, actually, I did practice the symptomatic care at the beginning of my practice. And over time, I became more the vitalistic chiropractor because I've seen the changes in my patients. It was amazing. You know, they come in for pain, but then when you start treating them and adjust, I don't like the word treatment because we don't really treat, but when you start adjusting the patient, you see the changes in their health change. Like they have more energy, they're more focused, their memory changes, they have more, you know, the retention is better. I've seen patients like their blood sugar have dropped. I have seen pregnancy, like, you know, you probably heard of like, oh, my chiropractor got me pregnant. Yes, because your body's more functioning at a higher level. Things are functioning in a higher level, your organs and glands, and your body is able to do things what it needs to do.
That was pretty amazing. I'm so glad you were able to share that with everybody because, yeah, I always just thought that you have pain, you go see a chiropractor, and they help, you know, readjust you to get rid of the pain. But I really like your analogy on how you can alleviate pain or balance the body more than anything else, right?
Yeah. Like the balancing is, you know what I like to call myself. I'm like the, you know, like those car mechanic who just tunes up the car and now the car is functioning better. Mm-hmm. That's exactly what chiropractor does. We don't work with the symptoms. We just like, you can just lie down on the table and I can see where the imbalances are and I just correct that and everything flows better again, right?
Well, you know what, as a past mechanic in my prior life, before I got into real estate and do real estate now, I used to be around when tune-ups were actually fine-tuning and adjusting carburetors and stuff like that. So I know exactly what you're talking about, and I can sort of relate. So that's great. I'm glad you shared that with myself and the audience. So maybe you can, what has been your biggest challenge while being a chiropractor?
My biggest challenge as a chiropractor, you know, I told you I have a family life too. So, you know, trying to balance that, you know, have your own practice and then also trying to, you know, balance your family life. But, you know, the thing is that great news is that because I have my own practice, I can manipulate my schedule, right? So I have my hours are like limit, like I try to cut down my hours, so making sure I have enough time at my work and also time at home as well. And the other challenge, actually I have another challenge that I want to also share is getting the message out. Because sometimes, you know, you want to tell and educate everyone out there, but then sometimes it's hard for people to comprehend it. And I understand where they're coming from because I have been there. Like I used to think that for every single issue, you need to take medication. That's where I came from. So I want that to be changed. I really want the world to know that the body has that power to heal from the inside out. And the only way for them to understand that, they have to be open. And the one way I try to educate through YouTube media, which is, it's very challenging because, you know, you see people and what you see is not always how it is. You understand what I'm talking about?
Yes.
Yeah. So what you see visually is not exactly how life is. So, you know, people see me adjusting on YouTube and they don't get it exactly what I'm doing. So I want to I'm thinking ways, how can I bring this message out so people can understand this better?
And doing this interview is definitely a good start because at least you can get people to sort of listen to you and talk to you before they, you know, like you said, just see the video or read about it or whatever, right?
Exactly. Yeah. You got it.
So let's pretend we can go back in time, maybe before you started your chiropractic clinic. Knowing what you know now, what's one piece of advice you would have given your former self?
One piece. There's a lot of pieces.
Well, you can name a few. It's you're allowed.
I'm not the same person who I was before. I mean, like in terms of how I see the world, as I said, like I saw it in a whole different. It's like, you know how Christopher Columbus saw the world was round, and before that they thought it was flat. So that's how I saw everything else before. Just trying to make it more simpler to make it understand, but. It's like, you know, how when we were back in the days, I never used to appreciate things. to be honest with you. And now, like every single thing that I see, I just started to appreciate. It makes a huge difference because we don't even know what we have in our hands right now. And it's amazing to see that, like, until you lose something. Do you understand?
Yes, totally.
And that, and also time management. I used to complain when I was single. I used to complain about time, like I don't have enough time, like when I'm gonna get this done. I was not structured, and now it's that, like, I still have 3 children, I have a husband, and I have a practice, and I do my research. I take seminars. I'm still able to manage everything, and I don't know how that happened.
That's pretty incredible. You had no children and you had no time. Now you have 3 children and you're still managing the same 24 hours a day and you're getting all that done. That's truly amazing, Dr. Rogini. That's good. That's really good.
So I have to learn to appreciate that, I guess. So I don't know what else to say.
Well, I mean, you've said it. You've said a pretty good amount of information there. I'm glad you shared that with us.
Thank you.
Okay, so you must have lots of stories of how you've helped people, but take me to a time when you thought, wow, I'm making a difference.
You know, when you see miracles in your practice, that's what I said, like, that's when you see that you're making a difference. And you know what? Sometimes the miracles don't happen all the time right away. It takes time. But when you're able to see those people who can function again, they're independent again, that's the best thing to see. Because you could, like, you know, when you're independent, like, you don't have to depend on anybody. That's the best thing you can feel. Don't you think so?
Absolutely.
So I have sometimes like elderly people, and the great thing is because I practice a technique called, because I actually didn't mention that before. That's I don't know what I didn't mention, but I practice a gentle technique called KST, Korean specific technique. So it's not the traditional chiropractic. It's a little bit more fancy way. It's a different way of chiropractic. There's multiple techniques out there. There's over 400 different techniques. So this one you can address. It's gentle. There is no manipulating, like there's no cracking of the spine. But again, I'm not saying cracking is wrong, because I do get sometimes manual adjustments because there's no one else who practices KST around here. But it's more gentler, so you can work on, like, you know, elderly patients as well. And when you see them really change, when they tell you, like, oh my God, I can clean things, I can cook stuff, I can stand up, do this, like, do what they want to do, that just amazes you, you know. And then also thinking back, like, you know, thinking that, how about every single person in this world, all these elderly people out there, every single person get adjusted? Where do you think the world would be?
A healthy place.
A healthy place. Like, you know, you have less people, less depend on these medications, and less side effects. Again, sometimes medications are necessary, but I think not all the time, right? Because sometimes they can get out of those medication and be more functional than more less functional. Does that make sense?
It totally does. And I don't know where I got this. I may have heard it from different places, different people, but what I've heard and what I go by or live by is that we have a pharmacy located in our bodies naturally.
You got it.
Yeah, and if you take care of yourself physically, you know, and take care of what you put inside your body, your body will fix any problem. If you will even have a problem, because if you take care of it from the beginning, you won't even have issues.
Exactly. And that's the principle of chiropractic. That's what chiropractic really follows. The body has the innate power to heal. What we have to do, we just have to remove that interference, and the body starts healing. And the interference can be caused by multiple things, like, you know, your emotional stress, physical stress, chemical stress. Again, like chemical will be like your food, emotional will be thought process, how you think about, like, for example, before this interview started, I had a little bit of anxiety. That's human nature, right? We all go through that.
Of course, me too.
And when you have this anxiety, be aware of your body, like what's happening to your muscle. They get all tensed up. And what do you think what happens to the muscle when they tensed up? The bone changes, right? Everything starts to shift and things are stressed out. So when you have chronic stress to the body, like let's say chronically you have anxiety, your body is going to shift off and everything's not going to function and flow well from that brain to the rest of the body.
You know, I've heard, and maybe we're getting a little bit off topic here, but I've read books on this before, that pain is a lot of pain has to do with not enough blood flow to that area. Is that Is that something, am I right about this? Or is that?
I would say that too, yes. But mainly sensation, the pain is just the brain is telling you something is not right. Right?
Mm-hmm.
So there could be two types of, I actually have a video online there where I'm adjusting my son, but, I'm talking about the pain because there's two types of pain. A direct pain where you can just hurt yourself and something, you just directly injure yourself and you feel it. And how do you feel it? How do you think you feel it? It's the brain telling you something poked you, right? So it's the nerves that receive that signal. It's the nerve that really makes you sense something.
So in essence, the pain really is all in your head.
In your head. So if there's a disconnection, you got it. So if there's a disconnection, let's say you cut that nerve, the pathway from the sensation where you feel the pain and where the brain receives it, you're not going to feel it. This is why some of the problems are missed, because out there you can have, let's say, you probably heard of people with diabetic neuropathy. They don't feel sometimes the problem. They have a wound inside and they might not even know, like an infection. They might not even know because they're not feeling it.
Yeah.
Yeah.
That's why we need chiropractors.
We need chiropractors, but most people say we are plenty. No, we're not plenty, because this world is populated with so many people. It's not enough, actually. Mm-hmm. And once one gets to understand what the importance of chiropractic, we're not going to have enough.
And the other thing too is we are, I hate to use the word brainwashed, but we are brought up thinking that, you just got to go see a medical doctor and get medication. But I know, and you know that that's not the right way to do things.
And I have been there. I totally understand you, because remember I told you I wanted to be a medical doctor before. I'm so glad I made this choice now where I'm right now. I don't think so. If I didn't make that choice, I think I'll be much more sicker right now, because I had a lot of digestive issues back in the days. And I think because of this chiropractic profession, it made a huge difference in my life. But yeah, it's just that mentality. My kids know that already. I'm training my children. My children know how to have a healthier lifestyle, which we didn't know as children. So I hope we can educate as more children as possible so they can live. Medication should be the last resort, not the first resort.
That's very well said, Dr. Rogini.
Mm-hmm.
Let's dig a little bit deeper. So let's imagine we dropped you on an island and there are no chiropractors. Nobody knows what chiropractic care is. Tell us the benefits of why these people should be using your services.
Oh, sure, I can say that. So first of all, this question is hard. It sounds hard, but at the same time, you know what? It's easy as a chiropractor. I don't know how it's for another profession, but in terms of, this is essential. Your body is essential. If without a body, we cannot do nothing, right? And you need that brain to communicate properly to every single organs and glands. And how it communicates is through your spine, right? Your nervous system, your spinal cord that's in your spine, right? Mm-hmm. And as a chiropractor, my job is just to remove that interference so the brain can communicate in a high level to all the rest of the body parts, and like your organs, glands, and tissues. So you can function better, you can do your daily things better. So it should be part of your lifestyle. Does that make sense?
Yes.
So example, if someone comes in, who has back pain and all that stuff, and they have all these symptoms, right? But the thing is that chiropractic is not a symptomatic approach, right? We work with balancing the nervous system, removing that interference. So what happens is the byproduct, the symptomatic relief, is just a byproduct. So you think you're really fixing the symptoms. That's what most people think as a patient. But really, you're balancing the system. The pain relief is just a byproduct of the care. Mm-hmm. Secondary byproducts are you have more energy and your body can function better. You have more ranges of motion. With kids, I've seen children with ADHD, they're more focused, right? They're able to hyperactivity is reduced, or their sleep patterns are better. Little kids with infant colic, you see them. They're not struggling as much. Sometimes you see these babies like all these moving like a little worm, because they're all tensed inside. They can't express their feelings. They can only show through their body. And all these changes are because you're just removing those interference and making sure the body functions in a higher level.
That's amazing. So get off topic of the body and how we can get ourselves more healthier. Is there any kind of like internet resource like Google Calendar or Evernote that you can live without?
For me, I need my calendar. Definitely need my calendar. I sync all the stuff together, and I tried using different apps because now we all have with the Samsung or iPhone, whatever phone you have, so many apps, and I think it could be very distractive too. Like it depends on what type of lifestyle you have. It depends what type of practice, like what type of business you have. I think the main thing for me is my calendar. And also my GenBook app. I don't know if you heard of that. That's how we book our patients, and you can use it for any type of businesses, not just any form of clinical, but you can use it for other type of businesses as well.
It's interesting. No, I've never heard of that.
Yeah.
So, is there any book that you've read or quote that you live by that's helped mold you?
Okay, I have a big smile when you're asking this question. I read so many books and I read online. I pick things that resonates with me. I think that's what most people do out there. I can't think of a specific book. I have my thought leaders. I do listen to a lot of stuff like that. But the main book that at the end of the day I come back is my spiritual books. I try not to mention any titles, but at the end, we all are human beings. We have days when we're up and downs, like emotionally down, or, we're humans, right? And only one book that keeps me going are my spiritual books, and really grounding myself back and reminding my purpose, reminding myself as a chiropractor, as a mother, as a wife, and to myself. It's like, that's what I can say. I don't know what else to say.
Well, that's it. You've said it. I mean, obviously we all need to get back to ourselves, because if, we have to live spiritually or through our sort of like our inner selves first before we can help other people, right?
Exactly. You have to cleanse yourself. It's good that you brought that up, because cleansing is important, especially when we keep a lot of resentment or hatred and all that stuff. You have to pray every single day. And I don't know, like some people don't use like the word probably praying, but because they don't believe in anything. But whatever you don't believe in, that's also still a belief, right? So it's very important to kind of forgive yourself and forgive for others. And because if you keep all that in, especially because I do work with mind body in my practice as well, like with my patients, I work a lot with emotional stuff as well. So it's very important for us to forgive, because when you don't forgive, imagine you just feel that when you have resentment towards someone, what do you feel inside?
Oh, it's bad.
Who does it affect? It affects probably the other person too, but it affects you first of all, right? And that's the last thing you want to have, because when you're unhealthy, you cannot serve. Meditation is so important too, because I see the pattern. Sometimes, you get too caught up with your life and you forget to meditate, and you can see how you fall back behind again. You can just see it. And it's so important, because meditation really opens up your senses and really heightens you. You probably have seen people how sometimes you hang out and you're like, oh, you have the same thought as I did. It's because you're actually sensing their energies. I'm trying to give you a simplified version, but that's exactly what meditation is. You're kind of sensing and you're kind of connecting to yourself, and you're able to understand the universe in a better way too.
Very well said. Very well said. I appreciate you joining us today. Now, how can our listeners get a hold of you, Dr. Rogini?
One way is through HHC, our center. Or you can actually find me on YouTube channel, and we have you can find me through my name, Dr. Rogini Tirukumuran. It's a big last name, but I think just typing out Rogini, you'll find me there. And on Facebook, Dr. Rogini Family Chiropractic, and I have a Facebook fan page, and you can find me that way.
Perfect. Well, I'll have all those links on our website at the gtadvisorspodcast.com website, and all the information will be provided there. So again, I really appreciate you coming onto the show and sharing all this wonderful information and opening my eyes, and hopefully opening up our listeners' eyes to the different types of chiropractic care that is out there.
Absolutely. You know what? As I wish I can say more, but there's only a short period of time. So.
Well, we could always have you on again. I mean, we can definitely dig a little bit deeper.
Sure. Thank you so much, Robert. I'm really happy that you're able to allow me to talk on this. Thank you so much.